Good morning. Welcome back to the Sculpting the Foot series with myself, Dr. Blake McCain, and Dr. Noel. Dr. Noel is a podiatrist of over 20 years' experience out of the United States and with Caribbean heritage, or more South American heritage from a country called Guyana. So, we're going to be having the conversation today about the ugly foot. What's the ugly foot? So, I'm Dr. Blake McCain. I'm a trained and licensed medical doctor. I practice in Jamaica, and I'm also a public health specialist. And I have a number of years of experience, close to 20 by now, I believe, or over 20. I've got the number, working in the hospitals in the Jamaican environment. So, Dr. Noel, welcome to our Sculpting the Foot series, and we're talking about the ugly toe today. And my first question is, how are you doing?
I'm fine, thank you. I hope you can hear me.
I can. What's the weather like where you are?
It's much better today. It's
What
still
does that
cold.
mean?
The snow has melted. Yeah, so it's much better.
What's the temperatures like? Because for us, we're 80 average.
Let's see. I don't even know. That's how nice and warm it is. The temperature today in New York City is 38 degrees right now.
Really?
Convert that.
That's what, 38 watts? Can't what is Fahrenheit?
That's Fahrenheit.
And that's warm. I'm talking about 18 degrees Fahrenheit here in Jamaica. You're telling me 30.
That's for us these days, these past few weeks. This is warm. This is warm for me.
Oh my gosh. No, I'll be frigid.
I can go out without 3 layers of clothes. I can maybe wear 2 layers of clothes now.
I can't imagine going through that and have brain freeze even when layered. 38 degrees Fahrenheit. Okay, we're a little bit more. It's sunny here. It's sunny.
That's beautiful.
And we can go to the beach and the water is warm. Warm meaning like close to still warm.
Beautiful, beautiful.
All right, so now we have spoken about the weather. Today we're talking about the ugly toe. The ugly toe, not something you find in the medical book. It's something that patients, doc, I don't like how my toes looking.
Yeah.
People tell me that my toes ugly, or I don't like wearing slippers, or I don't like wearing this shoe because it shows my toes. And then you have those that walk with their toes like this because they don't want anybody to see their toes. So what's the ugly toe? What would you describe as the ugly toe? As a podiatrist, in your experience and based on how your patients would come in, what would you describe is the ugly toe?
Okay. I'll get politically correct and say that the challenged toe, the appearance challenged toe. It can be caused by so many different things. It's hard to say. It's different for everyone. I may look at a toe and think, hey, that's a healthy toe. But to the patient, they're having a breakdown. Doc, my nail has a spot in it, and it's completely devastating to them. So, it may include things like disfiguration with the nail, which can be a number of things. That can be fungus nails. It could be just a very thick nail. It could be an ingrown nail or a damaged nail. So-called ugly toe can include like the shape. Maybe the toe has a bunion. That's when I know you'll describe it well, when the bone sticks out the side of the or it could be hammer toes. We discussed that before, when the toe is shaped like this, like claws. Mm-hmm. It could have been a fracture that made the toe misshapen. Mm-hmm. And you can have things like discoloration and sores on the toe. Discoloration could include hyperpigmentation where it looks darker, or hypopigmentation where there's a white patch on it, or
Mhm.
redness. Could be so many different things. There could be an ulcer on the toe, pain. That's not something we can see and call it ugly toe, but to the patient, it's part of their experience. We have pain.
Right, right. So for us as physicians, when we see our patients, they're ours, and though they feel a particular way about their condition, they come for help. We're not there to judge. We're there to help. So the term ugly toe is what they'll tell us, they'll say that to us. And that's why I use that term. And so we're trying to speak in terms that they understand. And we now need to talk about what we can do to help them. So you listed quite a number of things. Let's begin with that thickened toenail. It's interesting. There are quite a lot of people with this thickened toenail that you describe. Can you tell us, what's the medical term that's used for this thickened toenail, and what's the cause of it? How does it appear? And what do patients, how do they feel when they come into you about this thickened? What do they tell you? What do they try to do?
Well, your first question, the names for these are for a thickened toe that is not infectious or infected, I should say, that would be called onychogryphosis.
Big
There's so
word.
many different names. There are names for toes that have like stripes down them. Onychogryphosis. If the nail is infected with fungus, it's called onychomycosis. Sometimes the side that the nails are ingrown, and that also can become infected. That's called onychia or paronychia when it's at the sides. There's so many different terms for it, but for the patient, it looks disfigured and it's painful.
Yes, they call it the ugly toe. I
Right.
just get straight. That's what the people look at them and tell them this, and they dislike what they're seeing. So we're having this conversation with you, and we're gonna talk about. Let's talk about first that thickened toe, that nail, that thickened toenail. How it first begins. What do people really do? Is it that they tend to go to the nail technician and then they try to shave this thing down? I call it a very violent process, but they do these things. What's the cause of this thickened toenail? And it just only thickens. It thickens, and then the color changes as well.
Yeah.
And after that, in some persons, you have these lines that you've mentioned. Can you go into the details of that?
Well, for the thickened toenail, there are many causes. Some of the most common causes are one, trauma. Trauma is a very common cause. Trauma in the sense that, okay, so there could have been an injury directly to the toenail. Trauma in that it could be repetitive stress on that toe from work boots, from a bad shoe, from playing a certain sport. A footballer may have this, some kind of repetitive trauma. So that's one of the ways. The other way is poor circulation can cause the nails to become thick and discolored. And then we talked about infection with fungus, whether it's a fungal infection or a yeast infection, actually. Those things can cause the nails to become thick.
So, okay. So you're saying that for our youngsters here in this part of the world where they like playing football, they may not have on the proper shoe wear, they may have on the proper shoe wear, and then they get injuries on the football field. Because a lot of our little boys start playing football from they're between age 0 to 10, and the girls too. The girls do it as well. And so injury at that point can cause changes in the toenail over time. Which toe is most affected? The five toes. That's
Yeah.
for those who have all five toes.
As you
Which toe?
the big toe.
The big toe.
Yeah.
The big toe is most affected.
Mm-hmm.
How in your practice, how do you assist patients who come in complaining of this thickened toenail with this discoloration? How do you help them? Is there anything that you can do?
Yeah, there are so many different treatments. After making an assessment and finding out how it started, um, the simplest thing we can do for them right away that usually gives them relief is to cut the toenail down. We cut it down. Sometimes we have to use like a little, not medical, well, we use a drill. We use a drill and we drill the nail down and we try to drill it down flat.
That word, when persons hear drilling,
Yeah.
they become a little scared. So is this painful? So is this painful for the patient, this drilling process?
Most people don't report pain. Some people report a little sensitivity, 'cause the drill. But most people don't report pain. And we just take our time and do it. And we see how the patient responds. We stop, we start again. Yeah, it usually goes pretty well.
So this drill that's used, just for the purpose of the listening audience, this drill that's used to drill this thickened toenail, is it like those drills, those, I like to compare so we can describe and so they understand what they're getting into when they come to see the podiatrist. Is it the same kind of drill, similar shape drill, pointy bit that's used, or is it something with a smooth surface at the tip that's then used to smooth off the top of the nail? How do you describe it to the persons who are actually listening now?
Well, we have different views. Some are like a little sander. Probably that's the most comfortable feeling. It's like a little sandy, like a piece of sandpaper, and it right as a drill bit. And then they have metal drill bits, which really do the hard work, the heavy work. And they're small. They're not like large and unsightly. It's not scary at all. If they go to the nail salon, I'm sure they have a version of the drills that we use, and most people are comfortable with that. So it's not anything that they'd be uncomfortable with in the podiatrist's office.
My question though is, you mentioned nail salon just now. For somebody with an issue like this, would you suggest they first get evaluated by a podiatrist, a trained physician, first because they don't know the cause of the problem that they have, before they start this drilling process? Would you suggest that?
Right. So yes, they should come in first to the podiatrist to make sure it's not, to see what it is, whether it's just a thickened nail, whatever the cause is, or to see if it's an infection that is causing the nail to be thick, like a fungal infection.
So fungal infection.
What we'll do is take a clipping of the nail and we'll send it to the lab. And the lab will determine whether it's fungus, yeast, rarely bacterial. If it's psoriasis is another condition that can cause thickening of the nails. There's so many different causes, and the lab can rule out certain diseases.
Okay.
Like yeast.
Okay. All right. So of the causes, which is the most common cause that you believe you see in your population?
The most common cause in the population I see is fungus of the toenails. Fungus of the toenails. And, for that, there are a variety of treatments. Some of the treatments are the same for if it was just a thick nail. We cut it down. There's another thing. We can use like a topical antifungal medication, meaning something we can paint on the nail or rub in the nail that treats the fungus topically. It is really difficult, however, to treat fungus with like topical medication. But they're making improvements. They're making improvements in these topical antifungals. Antifungals now that they can get into the nail a lot better.
Like the nail lacquers.
The
So they have
nail.
nail lacquers. We have some nail lacquers here that we use. Usually quite a bit expensive, more expensive than other things. But with the treatment method for nails, so we're talking about fungal infections as a cause of the thickened nail. So we've gone through trauma. We've mentioned trauma, whether from outside or just, being hit while, playing football or some kind of game, maybe something falling on the toe, maybe the type of shoe that's worn, a hard shoe, work boot for those who have to wear very hard shoes to work. Maybe ill-fitting shoes, where we spoke about that in our last episode, where the feet, when they sit in the shoes, keeps sliding forward and abutting the top of the shoe. So it hits the top of the shoe constantly. That's repetitive trauma. And for women who wear these beautiful heels that are pointy, and then, they're walking and the toes, not only are they squashed, we'll talk about that later, but the toes are being squashed. That big toe is being squeezed or squashed like squash in that shoe. And that repetitive trauma contributes to that change in the toenail. So now that we're talking about fungi and treatments, you spoke about topical treatments. So the fungal infection of the toenail, we describe it as a onychomycosis. Mycosis from micelles, because these fungi, like describing, they're like trees, and they produce little branches with little bulbs at the top. We can't see these things. These things are all microscopic. They're beautiful to look at under the microscope. I've seen them, and we all have in our training. But these things grow within the tissue of the nail, and describing it so persons understand how difficult it is to treat this process. And that's why we do not only use topical treatment, but we also give something by mouth to treat the fungal infection of the nail. Dr. Noel, when you have someone that comes in with a nail fungus, how long does it normally take for that nail to get better? By getting better, I mean clearing up and looking as nice and pretty as it used to be. What do you see in your practice on average, and what do you tell your patients?
So for treatment of the nail, of the fungus nail, it can take up to 6 months to a year. The full clearing of the nail. And that's because that's how long it takes the nail to grow out. This can be sped up by having your doctor cut the nail back. As it starts to grow out nice and new, you can keep cutting the nail back, cutting off the fungus, the infected part, and so that it meets up with the new growth. So that's a way to make it appear to look better. So that's tricks that you can do. But really, it can take up to 6 to 12 months to completely clear. And that's with topical treatments. So we mentioned the topical treatments, some natural things that you can use. Tea tree oil is good. Some other natural treatments. There's something called ozonated oils. Maybe you can go on Amazon and find those. So you're kind of like ozone therapy on the nail. The ozone breaks up the cell wall of the fungus and pulls off the fungus like that. So you can try ozonated oils. So those are some of the topical treatments that can be used, as well as topical direct antifungals. Some other things that can be done is laser therapy. They have different lasers now. I won't go into all of that. They have different lasers that can also kill the fungus and speed up this process. That will help to speed it up faster than a topical. If it's going to work, because these things don't work for everyone. If it's going to work, it'll work faster than a topical medication.
Question. I have a question. How is the tea tree oil applied, and how often is it? Where is it applied exactly? Do they apply it to the nail? Do they apply it to the periungual area, which is the area between, for our audience, between the nail and the skin that borders the nail itself? And does it stay on the nail for how long? So where do they apply it? How often should they apply this tea tree oil?
So that's the challenge. I'm sorry. That's the challenge with topical medications. They're very difficult to keep on. And so the penetration is not optimal. It's not always the best. But yeah, I would put it around the nail, the periungual area. I would put it at the tip of the nail, where you can probably see some of the fungal debris or the dust from the fungus. I would put it at the tip of the nail, between the nail and the skin, and of course directly on top of the nail. And
so when you say the tip of the nail, say this is a toenail, you're talking about this point.
Yes.
Good. So they understand. And when we say the periungual area, we're talking about
around
this area, the edges. So the oil soaks into the skin that surrounds the nail. Because the nail is impervious, eh? It's keratinized. This is for the general audience, quite keratinized. So this is the area she's talking about that you'd put it right around here, the tea tree oil. Okay, so that's one natural form of treatment, which could work or assist, or it acts as a coadjuvant to the therapy that you get when you go to the physician.
Yeah, because scientists or pharma, I should say, they are creating some formulations of antifungals in combination with other pharmaceuticals to make them more penetrable in the nail plate. Like I mentioned, the ozone combination, ozonation of certain oils can help them to penetrate better. They're using nanotechnology to certain antifungals to make them, again, more penetrable into the nail. So they're improving on these things.
Right. So you mentioned the term nano. We are going to wrap up a little bit this part of this segment. Persons tend to be afraid of nanotechnology because of the period we just came out of in the pandemic. Nano just means small. So that's all I want to say. It means extra small. It's smaller than what we were used to before. We did centimeters, millimeters. For us in medicine, we did milligrams, then we went to micrograms. Now we're at nanograms.
Right.
So it is just something that is that much smaller so that it penetrates your cells better. Cells are the smallest unit of life that makes up your body. That's a nice way of saying it. You're made up of trillions of these things that make us appear as we are today. So, Dr. Noel, thank you. We're going to take a little break and we'll be right back.
All right.
Okay.